Welcome to the DisabiliTEA, a podcast where we have candid discussions about all things related to disability. Short-term, long-term, financial claims, impact on other areas of life, causes in the workplace, and more. With your host, attorney Anjel Burgess. You can find this show at www.disabilityhelpline.com and on YouTube, Facebook, LinkedIn, Apple Podcasts, Spotify, Google Podcasts, Stitcher, and more. Now here's the host of the DisabiliTEA, Anjel Burgess.
Good afternoon, everyone, and welcome to another episode of the DisabiliTEA. Today, we are so excited to have with us Dr. Laklieshia Izzard, also known as Dr. Izzy, from Shekinah Counseling. Welcome, Dr. Izzy.
Thank you for having me, Anjel.
We are so excited to talk to you today. I have so many questions that I want to ask you. But first, if you will just tell us all a little bit about yourself and about your practice.
Absolutely. Well, I am a licensed professional counselor amongst many other alphabets that I also have. But some of the key ones are licensed professional counselor. I'm also certified to be a school counselor here in our great peach state of Georgia. I'm also a TRICARE, which is military insurance, certified mental health counselor. And then I'm also certified in an area that I really think is critical, even more so now, because these rates are increasing, but in question, persuade, and refer, which is a suicide prevention training to help individuals learn how to become gatekeepers, meaning recognizing signs and warning signs and symptoms and other areas as it relates to suicide. So those are just a few of some of my background areas as it relates to counseling and doing great work in the community as well. So also, after all of those great certifications and licensures, I now too am a community leader. So I do a lot of work in my community. I partner with our local elected officials to do work as it relates to mental health, work that relates to decriminalizing mental health within our communities, which is a huge area as well that we're continuing to work on and advocate for, amongst other things. Let's share some little background information about me as well. I am a original native of Greensboro, North Carolina. I am a proud graduate of the great North Carolina A&T State University, Aggie Pride, as well as a alum of Fayetteville State University, which is a great historically Black college as well. And I have to give them a shout out as well, Bronco Pride. But that's just a little bit about my background as it relates to counseling, as it relates to being a community leader, as it relates to my home of origin, and anything else you want to know. I'm sure you're going to dive into that too.
I will. I will. I do want to first ask you, with all of your experience, for our listeners and viewers who are meeting you for the first time, you are quite the mental health expert. And you have a counseling business or firm. So tell us a little bit about who you serve and what you focus on.
Absolutely. And just to share a little bit more background information on how I came to be an entrepreneur. I didn't mention this before, but I'm first generation female college graduate in my family. So I'm also a first entrepreneur generation as well. And so I didn't have a blueprint as it related to what entrepreneurship looked like. But I knew that I wanted to have a business that gave me balance. And in this field of clinical mental health, we have to have balance and self-care. And I know we'll get into that a little bit more, but that was my motivation in moving forward and developing my own private practice. So I was very strategic and very intentional about how I went about becoming an entrepreneur. And so I didn't just step out there by jumping or rushing and, trying to do what others were doing, within my field. I wanted to make sure that it was unique to my needs as well as to the clients' needs that I wanted to serve. And so I started my private practice in 2015, probably late 2015. And I thought that it would be helpful for me to see individuals online, to see them virtually. I knew that would help me to be able to balance my schedule more, create my schedule in such a way that would allow me to have the balance and the self-care that I needed. And so that's why I chose telemental health. And around that time, Georgia was getting to the place where they were becoming more on board with telemental health as well. They had just came out with a course that we needed to take as licensed counselors in order to make sure that we were qualified to do telemental health counseling. And so I did go through that series. I think it was about 9 credits at that time. I was really blessed, though, because my doctorate degree was from an institution and a program that was hybrid. And so I had already developed that skill set to be able to do a lot of technology-based serving. So I did teaching online. I did my clinical practicum online, did my supervision internship online. And so I was already in the groove of doing service and work in the telehealth field, in the telehealth area. So that really helped me. And so fast forward till today, I'm still seeing clients telemental health. I do not have a brick and mortar office and still like that because I'm able to balance my schedule. So I usually see clients about 3 days out of the week. That's my specialty schedule that I like to have. But amongst other things, as it relates to my practice, I also do trainings, mental health trainings for nonprofit organizations, for-profit organizations, for schools, for just really any organization that wants support around mental health and needs knowledge around mental health. And I do that, of course, virtually, and I also do that in person when needed. Of course, we know when COVID hit, most things were still virtual. So I did a lot of training virtually during that time. So that's one of my services. I also provide mentorship, what I call professional mentorship to professionals, whether that's professionals in my field with a helping background, those within the education field, because I also have a background in education as well, and just any professional that feels like they're stuck in their career. They're wanting to transition to do something more. And so I kind of take a step-by-step model that I use, that I created to help individuals discover their gifts as well as their purpose. And because that's what I followed suit after to ensure that I was able to develop, again, the unique and the best entrepreneurship experience for myself and business for myself. So I use those same principles and those same steps in mentoring other professionals as well. So those are my 3 primary areas. I'm getting ready to move into doing some other things as well with branding and imaging. So we can talk about that a little bit later. But those are my core areas that I've started out with. And I celebrated last month 10 years of entrepreneurship. So,
Well, congratulations. That is impressive.
Thank you.
Impressive. One of the things that you mentioned, Dr. Izzy, that of course my ears perked up when I heard this, is you mentioned the term self-care. And we are hearing that kind of collectively a lot these days, especially since COVID. And I want to ask you about self-care as it relates to clinical professionals. So people who, are in the business of helping other people. Tell us a little bit about self-care and maybe some tools that clinical professionals can use.
Absolutely. I'm glad you asked that question.
My ears perked up. I really was like, oh, I need to ask her about that.
And so just to piggyback off of what I was saying before, I knew that I was going to have to be intentional
Mhm.
about my self-care in private practice. I came from the community-based mental health clinical world, so it
Okay.
was very, very fast paced.
Right.
So I knew that I needed to slow it down
Mhm.
in my own business. But even though I did very well in that setting, I also worked in the prison setting
Okay.
here in Georgia, in the only medical prison here in Georgia. And so that setting was pretty fast paced as well, high technology based also. And so for me, I knew that I needed to slow my schedule down a little bit so that I could balance and manage it and ensure that I was taking care of myself. So, one of the areas that I focus on for me as it relates to self care and taking care of myself is number one, exercise. Many individuals like, oh, well, I may not be a gym person. You may not be a gym person,
Mhm.
but just getting out, doing that brisk 20-minute, 25-minute, 30-minute walk in your neighborhood or in a nice park nearby, that's going to get that blood flowing. That's going to get those limbs moving. And that's still very, very beneficial. There are times where I do a nature walk and do meditation with that walk. I'm a woman of great faith. So I also consider that to be a prayer walk for me. That's a time of solitude, a time for me to connect with God. And so, absolutely, that's a part of still my exercise and my self care that I do for myself. And then also, I go to the gym as well. I may spend 45 minutes, I may spend an hour, I may spend an hour and 30 minutes. But the key is, I needed to make sure that I had time for that in my schedule. And so I said that I see clients 3 days out of the week, but I make sure that I'm done by 2 or 3 because for me, it's mid-afternoon is my highest energy time for me. Yours could be in the morning, yours could be later at night or early morning. Whatever works best for you, you set your schedule hopefully around that time so that you can go during that time and do that exercise or do that meditation walk. Also, reading for me.
Mhm.
That's a good self-care tool. And that's usually what I read is self-help books. Many people are like, well, you do helping all the time. You don't read, novels or escape books. But for me, I just love, mind work. I love growth work. And so I love to continue to work on myself and improving myself and growing in different areas and setting goals, increasing my finances, my financial status. And so I'm always reading books and also listening to YouTube channels, even like podcasts that we're on right now.
Right.
Listening to those that are inspirational, that are informative, that are motivational for maybe about 10 minutes a day or 20 minutes a day. All of that is a part of my self care. Also, making sure that I get rest.
Mm.
People see that I do a lot in the community, that I do a lot. And many times they say, you're always in the community. Do you work? Yeah, I don't consider it work because I enjoy what I do. And my schedule is created in such a way that it's not stressful at all.
Mhm.
So it does not feel like work to me. But yes, I do serve individuals, fee for service, absolutely. But I also have that time embedded in my schedule for me to do my community work, for me to do the
Mhm.
service work, because that's still purpose work. And
Right.
so I want to make sure that I have that time to enjoy that. And so after I do my service work, I make sure that I have lots of time on the weekend where I'm just resting. For example, last week was a really, really full week for me. It wasn't a week where I was really out of the house, but I had a lot of online meetings and online trainings that I had to do, and they were all day. And
Mm.
so I had to really think about, how am I going to rejuvenate myself? What am I going to do to really get that self care for myself? So this week is a more of a relaxed week for me. And so I'm not seeing as many clients. I'll be
Okay.
resting more. I did this special podcast because I think Angel is great.
Oh, thank you. Thank you. I appreciate that.
So I already had that scheduled in, and I knew that that would be fine for this week. But I'm very, very intentional. And
Mhm.
something I make sure to do too, as it relates to rest, is some days I will do nothing. Absolutely nothing. That is
Wow.
so important for us as clinical practitioners, as community leaders, as individuals who are influencers, and we're working in are walking in our purpose. We
Mhm.
can get very busy with purpose and tend to forget that we have to have that downtime where
Right.
we do absolutely nothing. So if that's a Saturday and you want to do a binge on Netflix or Lifetime, or you just want to kick back, you want to read, whatever
Right.
the case may be, you have to incorporate that into your schedule at least twice a month. I
Mm.
would say at least twice a month. You
Okay.
need to have that escape time, is what I like to call it. That's an actual tool to just escape, get away from the regular, day to day, of what we're used to engaging our minds in. And I do so much brain work. I mean,
Right.
it takes so much of my energy. And believe it or not, a lot of my soul and my spirit is wrapped up into my work as well. And so if I don't take this time to relax, if I don't take the time to rest, to really just shut off, to turn off for a while, it will be very challenging and difficult for me to continue to move forward in the work that I do. And that is why we do have something in our field called burnout,
Right.
called compassion fatigue. We
Mhm.
also have vicarious trauma that comes from listening to individual stories that are very traumatic and listening to them over and over again. You heard me say that I'm a TRICARE mental health counselor, so I worked several years with the military population. And noticed for myself that I experienced a little bit of vicarious trauma during that time. There was a time I couldn't look at military movies. I couldn't really focus on anything that was related to military culture outside of work, or I would feel anxious. And so that was a part of some of that vicarious trauma, even though I always worked from a cognitive behavioral therapy framework. And
Mhm.
so I never really allowed my clients to dive deep into trauma, but there still are instances where they have to speak about some of that trauma. And
Sure.
because I saw so many, veterans, during that time within my career, that was definitely, a result of that. But again, that's why self-care is so important, so that we don't reach burnout, so that we don't feel that level of exhaustion, all of that stress, compounding on us. And what's really sad is that we find many individuals have reached burnout and they're still trying to work.
Right.
They're still trying to do it. And it's so sad and unfortunate because they're not effective when that happens. And then it may turn into compassion fatigue. And then that's when your compassion, is really zapped. You know,
Right.
I use this example all the time with one of my former colleagues, and she doesn't mind if I share this. She's long into private practice now, but when we worked in clinical mental health together, she experienced burnout and compassion fatigue, so much so that we were in the office one day, and mind you, we work in a clinic. And so
Mhm.
clients would come back and forth, in that area as well. And she just yelled out one day, I'm just really getting tired of getting stuck with all the cuckoo for Cocoa Pops. And I
Oh
said,
my.
oh my. And I said, okay, let's take a walk outside and let's have a talk about some things. And so after having that conversation with her, she began to break down in tears.
I'm
And
sure.
so I knew that she was at that place of burnout and compassion fatigue. And I had to speak with her about changing settings, and taking better care of herself. Because by that time, she felt like she needed to come out of the field altogether.
Altogether.
And it feels that way when you are experiencing burnout or compassion fatigue. But she was an amazing counselor. She's still an amazing counselor. And so my encouragement to let her know that no, you just need a change of setting and you need to decrease your stress levels. And
Mm.
so absolutely self-care is critical for those of us that work in the mental health space.
Mm. Wow. I really like the theme for you, the belief that being intentional, right, with everything that you do, that is so important. And I feel like that is just a really underappreciated thing to do. You know, we kind of tend to be more reactionary than intentional, right? And saying, this is what I'm going to do. This is what works best for me. So I appreciate that, because it's good for me to hear that as well.
And I had to learn that. But you know what, Angel, I had to learn that. And that kind of goes back to the things that I had to do to prepare myself to be the best entrepreneur that I could be. Because remember, I said I didn't have a blueprint. And
Right.
so I had to invest in myself. And
Mm.
so one of the things I invested in was a business coach, was going to business seminars for Black-owned businesses,
Okay.
even specifically. And that was something that I learned from my business coach. She actually took me through a step-by-step phase to learn about growth and why growth should be intentional for us every year. And we actually utilized the book by John C. Maxwell, The 15 Invaluable Laws of Growth. And
Mm.
that's his first law of growth, the law of intentionality. And so that's how I learned to really be so intentional about everything that I do, in my life, whether that's my business, whether that's in my finances, whether that's in my relationships. I have to be very intentional about what I feel is a support and a benefit to my growth. And what I love to say as it relates to self-care and my preservation,
Mm.
because self-care is never about self-indulgence. It's always about self-preservation. And
Right.
so if you are not preserving yourself, preserving your mind, preserving your body, preserving your intellect, your knowledge, your time, all of these things, then you find yourself, like you said, being more reactive based. And
Yes.
before you know it, you're trying to run around here like the Energizer Bunny, and you're doing all these things for other people, and then you're leaving yourself last. And what ends up happening as a result is your physical health begins to suffer.
Right.
And that's where we begin to see more people then realize, oh, I should have took better care of myself,
Right.
because your body will let you know
Mhm.
when it's had enough.
Mm. So true. So true. So, with the mental health space that you work in, and I know that you are really active in the community, you're an advocate. Um, I want to talk a little bit about Black male mental health and the work that you do as it relates to that particular population.
Absolutely. And thank you again for that question. My expertise area in working with Black men started when I was working with the military population. And
Okay.
so I worked primarily with Black male United States veterans.
Mm.
And these were veterans that had post traumatic stress disorder, that
Mhm.
had depression, that had anxiety based disorders, that had something that we call moral injury. That's when the service member feels a lot of guilt and shame around some of the things that they've done in the military. And
Mm.
they then feel a disconnect between them and their faith, or them and God. And so that was something that I saw a lot within that population. And actually, and we'll get to this later, but how I came up with my own treatment approach titled Faith Inspiration Therapy in working with that population. But I saw a lot of unique characteristics working with Black male veterans.
Mm.
And I realized that their stories were very unique. And I also realized that many of their treatment efforts, they were being, just not treated what we consider to be optimal. So not getting optimal treatment that they could get, because a lot of their challenges were misunderstood, you know.
Mm.
And so many Black men, and most people don't know this, but they suffer a lot of discrimination, and on a daily basis.
Mhm.
And so this is something that they experience in their life. And some of them have become just norm, it's like the norm, to them, because it's something that they experience so often,
Mhm.
in their mistreatment. And that is in multiple systems. And so when we start to talk about these systems, we're talking about the educational system, we're talking about the criminal legal system, we're talking about the healthcare system. Black men are discriminated on more accounts than any other population in these systems. And so that was something that I really began to see, and that was an area that wasn't addressed enough. And so when I really started to do more of my community work, that was something I knew that I wanted to address. And so I started having a Black male mental health symposium. And I will be
Okay.
celebrating year 5 this year in
Wow.
June.
Okay.
Time goes fast, I tell you. So,
Congratulations. So
and I,
let me ask you
Mhm.
just about that. You said it's in June. So when and where is the symposium this year?
Mm, absolutely. For the last couple of years, I've been doing it in partnership with my church, which is the Berean Christian Church, and that is in Stone Mountain, Georgia. And
Okay.
that is, you can also Google it, but it's right off of Young Road in Stone Mountain, Georgia, at the corner of Young Road and Panola Road. And it's going to be June the 29th. I always do it in June because June is Men's Health Month.
Mm.
Most people are not aware of that, but June is Men's Health Month and the color is blue. And so I do it in partnership with them. We do it on a Saturday and we start at 9 a.m. and we finish up about 12:30, between 12:30 and 1 o'clock. And what I do is I have a keynote that I bring in every year. I bring a different keynote in every year. And then I also already have a list of men that are on my team that usually follow me every year. There may be one or two that's out each year due to family and different things, but most of them have been with me every year. And so I'll usually do a panel discussion. And now I'm doing breakout sessions because I've had so many to join my team that I had to get creative in doing some other things other than them just, getting up and speaking for, the 20 minutes or 30 minutes. And so it's been really, really impactful. It's creating a safe space for Black men. I
Mhm.
also allow women to come as well because I know women need to learn about the challenges that our Black men face so that we can better learn how to approach them, how to communicate more effectively with them. Something that I've learned too more about Black men is that they wear more masks,
Mm.
you know, and it's because, again, it's a result of the way they've been treated, by society. And so they can't really show up as their authentic self in many settings. And so they have to learn to put on mask, in all of these different settings. But we really do a deep dive in the symposium. We focus on their mental health. We focus on how they're addressed in the community. We focus on trauma. We focus on suicide. We focus on racial equity. We focus on quite a few things. I always have an elected official also that's there. This year I'll have two, one that's former, one that's current. But I always like to make sure that we have a Black male who's within government and who's with
Excellent.
local government. And so that we can share again with our men that we're needed in many of these spaces. And one of the things that I always like to reiterate to our men and to individuals when I talk about the symposium is that, number one, their experiences are very unique and Black men must be validated. Their experiences must be validated and they should not be compared with anybody else's experiences because they are not the same.
Right.
And then also understanding that Black men innately are leaders. They're innately leaders. When we think about some of the major leaders within our society, Dr. Martin Luther King, Malcolm X, so many others, Medgar Evers, so many others, many of them are African American that have led great movements, across our nation. And so leadership is within them. And so that's something that I like to speak to within them as well at the symposium. And I always have a breakout session specifically around leadership for them as well. So that's just a little bit. June 29th, 9 a.m. in partnership with Berean Christian Church. And we always do it live stream as well. We always do
Okay.
live stream too, in person and
Wonderful.
live stream.
Wonderful. Well, you do so much, good work for the community. And I know that earlier you stated that you are the proud alumni or alumnus of not one, but two HBCUs. So I wanted to talk with you about that because I've seen on Facebook that you do some work also with HBCUs as it relates to mental health for college students. So tell us a little bit about that.
Absolutely. Well, I do a lot of great service work for the National Alliance on Mental Illness. And so that's kind of where my walk started with doing some of the actual mental health based work
Okay.
on HBCU campuses and partnering with other nonprofits as well. And so one of the really, really big events, first events that I was a part of was in partnership with NAMI National. Silence the Shame, which is a nonprofit here that focuses on mental health awareness in communities of color for young people as well as for adults. Also, who is in partnership with that, and of course, Clark Atlanta, which is a great HBCU. And so we had as a guest speaker to come out to this particular panel event. It was Mrs. Keisha Knight Pulliam. And as we know, she is a proud alumni of Spelman
Right.
University. And so they brought me in for the clinical perspective. And so I was so, so grateful. And we were able to serve the students. We were able to talk with them about a lot of mental health challenges that they experience on campus. We got a lot of great feedback from the students. They were really, really engaged for the whole 2 hours. You know, if students don't get up and even go to the restroom, they are engaged.
Yes.
And we live streamed that as well. And so I think we ended up getting probably about 800 views
Oh,
uh,
wow.
for that. So, again, anytime you're working with young people,
Mhm.
young adults, and you get that many to view, you're saying some good stuff. You're
Absolutely.
saying some good stuff.
Absolutely.
So it started there. I was blessed to also be able to help plan a panel discussion on my alma mater's campus, which is North Carolina A&T State University, the largest HBCU in the nation. And I was able to do that in partnership with NAMI as well as the Hartford Group, the insurance company.
Excellent. Okay.
So that went really well. We had over 500 students to attend that particular event. We was able to give them resources, again, able to have good, thorough discussion and dialogue. So that's where my work started, and I'm continuing that work. So I partner with other organizations, other nonprofits that are doing work on HBCU campuses as well. Clark Atlanta, they just did their annual mental health event this year. I was there. They had a young Dro as a guest to share about some of his mental health challenges and past
Mm.
addiction challenges and recovery walk. So again, it's just a different world, but again, a needed world. Many people don't know that suicide is now the second leading cause of death on college campuses.
Wow.
And even more so for our students of color within the African American community, our
Mm.
suicide rates have drastically risen, just within probably about the past 5 to 6 years or so. The Congressional Black Caucus, they actually did research around this, and it's online. You can Google it. It's called the Ring Alarm research. You can Google that, and they do a deep dive into where they think much of it has stemmed from. And
Mm.
so, again, it's just an area that we have to continue to focus on because, again, our young people are our future.
Right.
And again, we don't want to continue to see these suicide rates continue to increase amongst our young adults.
Absolutely. So that kind of leads me to my next question. You're talking about mental health and young adults and some of the work that's been done on HBCU campuses. But what about just the youth mental health crisis in general? I know that you're involved with that as well. Tell us about it.
Absolutely. And my work there, Angel, what I do a lot of trainings for organizations that either serve youth or organizations that serve parents of youth.
Mhm.
And so I do a lot of trainings for the Georgia Resource Centers of Support that support adoptive parents as well as foster parents. Many people may not know, but the research states that as far as for young children who are in foster care, many of them have high rates of trauma background and mental health related challenges and disorders. And so I'm one of the few trainers that they have that focus on mental health. And so I've been training for them now, I think 9 years. Woo! Yes,
Congratulations.
yes. And I do all online trainings for them. I think right before COVID, we did a few more in person, but since COVID, everything has still been online because they've been able to get more participants across the state to join in on those trainings. So they chose to keep it as online trainings. But
Right.
that's one of the things that I do to ensure that parents are getting information that they need to help their young people. Of course, in my advocacy role, work that I do in going to the Capitol and talking to our legislators about different priorities, about early intervention, about
Mhm.
ACEs, which is adverse childhood experiences. All of that is still work that I do. But in my past, I was a special education teacher.
Okay.
And so that's where my passion stemmed from in working with young people because I worked in the middle school setting with, of course, young people with mental health challenges and conditions. And so it started there. And then when I became a counselor, I counseled adolescents. I'm not doing it currently now in my private practice, but again, the way that I continue to help to support and helping us with solutions for the crisis is in the community work and the trainings that I do.
Excellent. And it is much, much needed.
Indeed,
So,
indeed.
yes. So thank you for all the work that you do in the community. So I know that you told us about the men's mental health, Black man's mental health event that's coming up in June. Are there any other events that are coming up that you want to share with the community that may be of interest?
Woo. Well, what I want to let everybody know is that May is Mental Health Awareness Month.
All
Woo!
right.
And y'all see me with this beautiful green background and a beautiful
Yes.
green scarf. All of that is intentional, as
Mhm.
Angel says.
I knew it.
Yes, because green is our signature color for mental health awareness. And so it really does help to spark the conversation about mental health. I can't tell you how many times I've gone out and gone to our board meetings and, gone to different places and I wear my nice, green hats and
Mhm.
scarf and outfits and they're, oh, you look so beautiful in that green. And I say, yes, green is for mental health awareness. And so I'm able to start that conversation. So there will be so many events, you
Mhm.
all, that are going on this month. So I would really encourage you to, again, look at your local mental health based nonprofits, look at the National Alliance on Mental Illness, look at Mental Health America of Georgia, look at Silence the Shame, go on their websites. There are going to be mental health events going on. Well, I'm telling you, from May the 1st to May the 31st, there
Good.
will be many, many, many events going on this month. So please definitely consider doing that. If you want to reach out to me, Angel, I can definitely give you my email address. I can share it to them right now. It's my business,
Please.
which is Shekina Counseling. So that's SHEKINAH, the word counseling, COUNSELING at gmail.com. And if you would like to connect with me via email, I can definitely send you some flyers of some events that are coming up. Or if you just want to connect with me to receive any guidance or any connection to other resources, feel free to do so as well.
Excellent. And I want to ask you one last thing. I know that you have a book. So I want you to tell our audience about your book and perhaps the inspiration behind the book.
Absolutely. Well, I shared a little bit before that I did develop my own treatment approach, which is titled Faith Inspiration Therapy. And what Faith Inspiration Therapy is, it is actual cognitive behavioral therapy interventions tools that I have integrated with faith-based principles, biblical principles, even more so. And the reason why that was, in working with the United States veteran population, more so African American men at that time, majority of them had the Christian background. I was
Okay.
really grateful for that as well, because Christian is my background as well. So again, it's not for everybody, but for those of you that do have that faith base and that specific background, consider it. All of my publications are on Amazon. I have a book manual that is just for providers. I also have one that is for adults and adolescents, because the tools can be used among adolescents and adults the same way. One of the tools I already talked to you about, which is actually the prayer walk.
Okay.
I also do faith-based affirmations are in there. I also do something called faith-based mindful breathing is also in there. So I have just multiple tools. I also have some holistic tools in there as well. But just really, really grateful that I was able to step out in faith and self-publish that. I wasn't sure how some publishing companies would receive it, but I knew that it worked. I actually did the tools with the United States veterans that I worked with. I put them in a group, and I had them in a group for 10 weeks. And they did different tools within these groups over the course of those 10 weeks. And once they finished those 10 weeks, they were feeling much better. Their depressive symptoms were down, their anxiety symptoms were down, their PTSD symptoms were down. And I always share this little joke. So we had a little dinner potluck at the end, and we started laughing and talking about things. And so many of the men said, "Oh, I think I'm about ready to date now." I said, "Okay, I realize y'all are feeling better and you're feeling happy, but not just yet."
Not quite yet.
But it lets you know just how good that they were feeling and how it really, really, really resonated with their healing process. And so, because I knew that it was that effective, and effective, like I said, with what we consider to be a specialty population, then I knew that I had to get it in black and white in writing. So that's just a little bit about faith inspiration therapy. For short, I call it FIT. But
Oh, I
yeah,
love
feel
that.
free. Yes, FIT.
Yeah.
Feel free to go on Amazon. All you have to do is put my name in, or actually put faith inspiration therapy in. And actually, probably all of my publications will pop up. I've self-published probably about 7 books. And then I've also self-published a meditation CD as
Hmm. Excellent.
well.
Wow. Well, Dr. Izzy, you have shared so much helpful information. I really appreciate you coming. You've, you know, provided some gems that I'm going to personally take advantage of. So I thank you. I know that it will be very helpful for everyone that is watching and listening. Are there any parting thoughts that you'd like to share with our audience?
Absolutely. As a mental health professional, as a mental health expert, I have to say, please, please, please know that it's okay to not be okay. So if you are feeling any symptoms, you feel maybe any negative base emotions, you're feeling grief, whatever the case may be, don't go through it alone. Please consider reaching out to a professional. Again, you have my email address. If I need to connect you to someone, I will absolutely do so. If you're not ready for therapy, please, please, please consider support groups. The National Alliance on Mental Illness does support groups really, really well. Please consider, Googling. We have a state organization here in NAMI, Georgia. We also have affiliates. So usually there is a local NAMI somewhere near in your local county area. So all you have to do is reach out to them and they'll get you connected. They have free mental health based classes as well as support groups and so many other things to get involved with. Advocacy is something that's big for us too. If you don't know how to be an advocate, they'll teach you how to be an advocate. So again, just get on the mental health bandwagon one way or another. And the reason why I say that is because mental health touches every family. It touches every family. So you want to learn as much as you can about mental health. Also, if you're in a crisis, please dial our new crisis line number, which is 988. That is for any person that is experiencing a mental health or a substance use crisis or that just needs resources. 988. Thank you.
All right. Thank you again, Dr. Izzy, for sharing with us so much valuable information. And thank you all for tuning in to yet another episode of the DisabiliTEA. We look forward to talking with you next time. Bye-bye.
Bye-bye.
You've been listening to the DisabiliTEA with Anjel Burgess. Thank you for your positive reviews, comments, and sharing the show with others. You can catch prior episodes at www.disabilityhelpline.com and on YouTube, Facebook, LinkedIn, Apple Podcasts, Spotify, Google Podcasts, Stitcher, and more.